Hello.
Hi.
Good evening.
Good evening, Darla.
Am I sounding okay? Are you getting a feedback from me tonight?
Right now you sound fine.
Okay, good. Finally.
Sorry, guys. I'm trying to fix the camera.
Did anyone see Barbara Henke get online?
No, I didn't.
I didn't see.
Thank you, Barbara. We're just going to wait for a few more people. There's been issues with the network main, so I just want to make sure I have everyone. All right, so welcome back. This is week 10, and we are in chapter 12, which will cover chapter-specific guidelines for chapters 9 through 17. So we want to make sure that we have our ICD-9 book, and turn to page 44 if you have the small gray book. And page 22, if you have this book here. Let's see if we can get a little closer.
Did our teacher just leave?
I don't see her anywhere.
No, me neither. She just went away. Did you have a good vacation?
Yes, but it went very fast.
Yeah.
And you?
I'm very busy. I worked,
Yeah.
and I had this week off, but I swear you work more when you don't work.
Right. Right. Yeah, because you're gonna do all the things you could have done when you were working, right?
Yeah. Are any of you guys having any problems with the reports?
Yeah.
I'm having a very hard time with the reports.
Hmm.
I just gave up. I was getting so mad, I just couldn't even stand
Yeah.
it.
She said it might be frustrating.
Yeah, it was. I don't know how to pull out, get rid of all the verbiage and pull out the facts.
Hmm.
I wonder if she's going to be able to get back in. Well, we can do class together.
Here we go. I'm gonna grab a cup of coffee if she wonders where I am.
Go right ahead. Is that better? Not so bright. I'm right under my light, and I swear to God, it lights me up like a light bulb. Well, you guys, does your thing keep flickering?
All right, there we go. Thank you very much. All right.
Hey.
Okay, so we have Gardner, Darla, Barbara, Lisa, and Lisa Leonard. She might not be here. All right, so I won't play with buttons anymore. All right. So we're on chapter 12 in our textbook. Everyone can hear me okay? Gardner left. Oh, so Gardner.
No, we're having trouble over here. We keep going in and out in Gardner. I don't know what it is.
Okay.
I hope not. I hope I stay in. You know what? My husband even bought me a new computer so this wouldn't happen.
That was nice of him. Are you hardwired?
I'm on, well, no, yeah, I am. I have a Dell desktop, and I think that was my problem before, is because it was all wireless.
Yep.
So I went and got a wired baby up.
All right. So
One of the girls went for a coffee. She told me to be right back.
Thank you very much. Page 22 in the ICD-9 book, that's the big spiral bound book, or page 44 in the small gray book. The hick picks have not come in yet. They are still on back order, but we won't need them right off. And honestly, the hick pick books we might use occasionally throughout this class. And everyone is screaming for their books. We're not the only ones, so we have no control over it. For chapter 12, chapter-specific guidelines, what we're going to do here. All right, Gardner, I see you've joined us, but we don't have a picture. So turn to page 318 in your textbook. Your Buck textbook, 318. And start with the diseases of the digestive system. Now, the diseases of the digestive system basically start at the mouth and go through the anus and the accessory organs. You have a lot of extensive subcategories here. Just under category 574 alone, cholelithiasis, you have 10 subcategories. And you see in your guideline book that they actually have it reserved for future guideline expansion. And I forgot to bring highlighters and stuff, so, oh, let me get one. Yeah, take your highlighter out. And in the 574 category, each digit has a subclassification. When you have the presence of hemorrhage, that's usually associated with diseases in this chapter. So when you see hemorrhage associated with this digestive system, and always query the provider if the documentation is not clear, okay? All right. So you see the example that they give you in the book, diverticulitis of the colon with hemorrhage. So you would start in the index under diverticulitis. It shows you right there in the example. You would note the parenthetical note was acute, and the colon is perforated, tells you what codes, and then if it's with hemorrhage, what code you would use there. Remember I said in the beginning to read your coding shots. So for a hemorrhage to be reported, there does not have to be active bleeding. However, there must be documentation in the medical record that supports the fact that active bleeding has occurred, and the physician must identify the source of bleeding for the combination code to be assigned. So, documentation for the purpose of this course. I don't know who came up with all this stuff. I do know that they tried to create this out of live experiences, okay, life experiences. So a lot of the reports and stuff that we're going to see in our exercises come from life, okay? They're not just made up. And we don't have the physician to query. So there are times where we will have to use our judgment of what were they thinking and just do our best to code in that fashion. These reports, more often than not, will frustrate you. And that's okay, because that's how we're going to learn. Okay, and I believe I told you that in our last class. We just started on our reports last class. That's why I started going over them in class. so that we could look at them together and see what might you be looking for, okay? How are you going to know all this? I don't expect you to know all this, okay? You're just coming into this. You're learning a new language. It's just like when you were in school trying to learn Spanish or French, okay? Your teacher didn't expect you to learn it and be perfect at it, right? It was practice. So that's how we're going to learn this, by practicing with the reports. And I'll be able to give you little tips and tricks to, work through the reports, but sometimes they even still stump me. I'm trying to think, how in the heck did they come up with that? And then it's just after you read it and you practice and you read it, you get it. And so that's what it's going to be. It's going to be practice and trial and error. Okay? So pay attention to your coding shots. And when I talk about underlining and highlighting in your guidelines, that's important too. Because as you're coding, it will be important to know where to find those guidelines so that you are coding appropriately. Now, did everyone do the in-chapter exercises?
Yes.
Darla?
No, I read through.
Okay, Barbara?
No, I didn't do all of them.
Okay. So then it wouldn't hurt if we did some in class. All right. So let's talk about the gastrointestinal bleeding due to acute duodenal ulcer on page 320. Now you can say duodenal or you can say duodenal. So gastrointestinal bleeding due to acute duodenal ulcer. Well, first of all, why is it they're bleeding? Due to. Because of the due to. Okay? Remember we learned earlier due to and with. Okay? So the bleeding is due to the ulcer. Forget the fact that it's a duodenal ulcer. It's an ulcer. Okay? So we're going to start with ulcer. So go ahead and take a moment and look up ulcer. And then obviously, we're going to go next to what? What's the next area we would start with? So ulcer and
Duodenal bleeding. Oh, the duodenum. Yeah.
The duodenal?
Yes, duodenal or duodenum.
This is the only one I didn't get on this thing.
And then what type is it? They tell you right in there. It's acute.
It's acute.
And then we would look at, is it with or without hemorrhage? So just the fact that there's bleeding is with hemorrhage. So we would start off with ulcer, find duodenum,
Right there.
acute, and with hemorrhage. And then we would
532.0.
into our tabular and verify that what we found in the alphabetic index was correct. So now that you found it in the alphabetic index, go into your tabular and just confirm that's what you really want to do.
If I get 532.00.
that part is.
All right, so what did you get, Emily?
532.0.
Okay. Are we supposed to have a fifth digit subclassification? Which one would you choose?
I don't know this one. This is fine.
Well, that's fine. So,
I know I'm supposed to add the digits and I just don't understand.
okay. So let's look at 532 in your ICD-9 book. And the 532 is duodenal ulcer. We have a category, duodenal ulcer. And we have a pink box which says add fourth or fifth digit. So you see underneath it that it includes erosion acute duodenum, ulcer peptic duodenum, post pyloric. Use additional E code if desired to identify drug. It excludes a peptic ulcer which is not otherwise specified. Now they're telling you that the following fifth digit subclassification is for use with category 532. So 0 is without mention of obstruction, and 1 is with obstruction. The definition of a duodenal ulcer is an ulcer in the lining of the first part of the small intestine, which is the duodenum. So if we go over to 532, it tells us that it's acute with hemorrhage. So we know that we're in the right category with duodenal ulcer. We know we're correct with acute with hemorrhage. So if you look at that exercise again, do we have obstruction or not?
No.
That's what you asked
No.
me. So then it would be 532.00. Okay?
Okay.
So you see how we did that? You look at the category, look at the subcategory, and then ask yourself, which subclassification is it? Now you might have more than one or two, but you're going to ask yourself, whatever that subclassification is it with, is it without? Whatever those are. So ask yourself, okay? All right, and that's how we do it. All right, how about gastroesophageal reflux? Now, what is the main term here? What are we looking for? Reflux. Okay, so go to reflux and then find what type of reflux. It is gastroesophageal.
When you're doing these codes and it says due to, is always what's before that the first code and what's after that the second code? Is that how it always goes?
You might not have double codes.
Hmm?
You might not have two codes. You might only have one, which is a combination code.
Okay. Where was I?
So reflux, what type of reflux? It would be gastroesophageal. Okay, so what did you come up with, Barbara?
Okay. I think I didn't look it up the right way the first time, but I have 530.81.
Very good. Now, you probably went to gastroesophageal first.
Yeah, I think that's what I did. Yeah.
Now, going to gastroesophageal first is not necessarily wrong, okay? Just if you went to gastroesophageal, you probably ended up with laceration and hemorrhage syndrome, which brings you to 530.7. So you could still do
Right, that I was reading it, yeah. Somehow I found the right one.
right. So you could have gone to 530, which does tell you diseases of the esophagus, but you would have to keep breathing down until you got to the correct one. So that's another thing to remember. There really isn't, how do I want to say? There's a front door and a back door. Finding your codes. So Barbara, if you found the correct code by looking up gastroesophageal first, it doesn't mean you're wrong. It just means you took a little bit more time.
Right, I had to read through the whole thing.
Which, you're right, it takes a little bit more time, and when you're sitting for the national exam, time is of the essence. So you want to be able to find things more quickly. And that's why trying to do it through the front door will be a lot easier. And sometimes they're just going to stump the heck out of you. But when it comes to the national exam, you will have multiple choice. So you will be looking at more codes than you will be main terms. And as we get closer to that time, you will have tips and tricks of how to get through to it.
Hi.
Hi,
Is the school board meeting in here tonight?
over there.
Across the way. Okay.
Yeah. Okay? All right. Let's move on to diseases of the genitourinary system. Now, the diseases of the genitourinary system, your commonly used codes here are urinary tract infection. So if you look in your ICD-9 book, Chapter 10, diseases of the genitourinary system. Also, inflammation of the prostate. That's another common code. Disorders of menstruation and breast. Those are genitourinary system. The genitourinary system codes are used in addition to identify, or you would use an additional code to identify an organism. So when you're looking up these codes, you will see use additional code, or use additional code to identify organism. You will also use additional codes to identify lower urinary tract symptoms. Okay, so this is where paying attention to your notes within your tabular become very important. So for exercise 12-2, let's do number 2, hematuria. What is hematuria, Darla?
Sorry, it's blood.
Yes. So how are we going to look up hematuria?
Go to the index.
Yep. Yes,
I would almost say, can we look up hematuria?
absolutely.
Okay.
So everyone go ahead, look up hematuria. Okay, when you found hematuria, what does it say?
Non-essential idiopathic.
Okay,
Unspecified.
right, so go into your tabular. Okay, so in your tabular, what does it tell you?
5970.
Yeah.
599.
599.70. Okay,
Which is the fifth digit.
yes. So that one's pretty simple. Now, how about benign prostatic hypertrophy, or BPH? Can we look it up using BPH? Okay, so how would we start? Hypertrophy. What type of hypertrophy? It would be prostate. And what kind? Benign or malignant? So it's looking at these exercises and breaking them down. And Gardner, I know that you come on and you leave, and I'm sorry that we can't see you or hear you. So Angel, I will definitely make sure you get the link.
Is that any better?
I can hear you.
They had the mic off.
Oh gosh.
Yeah, lovely. I don't even hear the mic. It's on the desk.
Oh no.
I wanted to know if the instructor could give him a call real quick. Maybe
But-
he can fix that.
They're asking if you could call
Then maybe
Call
they
who?
them, that they might be able to fix it with you.
network.
They're on network.
I am the only person here right now, so if they're trying to call me while I'm on the line with you, it'll probably go straight to voicemail.
Okay, I don't know if she's trying. Is she
I
trying
don't
to
know
call
if she
right now?
can hear. Yeah, I don't think she can even hear.
The phone will ring
It's
because I'm
cutting
on the
out.
phone right now.
Because I asked her to call
So
me.
it'll just go straight to voicemail. She tries to call right now, probably.
Okay, so I'm gonna hang up, see if she can call you.
Alright, sounds good. Thank you.
Where's the box? That's usually on the table.
If she tries to call him now, she might be able to get him. She might not be able to get him because he was on the phone with me.
So Angel, are you asking me to call Network Maine?
That he said that he could take care of it if you called him. He's on there. Thank you. I thought this.
I'm gonna hear a rumble in a minute, guys. Sorry.
See, I have starving.
Hopefully they get a
She's
fix now.
Yeah, but it's also, it seems to be when we have the most problem. That was in the beginning, yeah, fine. She's the only one I can't see. Right. Yeah. Joining and leaving. Okay. Okay, thank you. All right, bye-bye. All right, Angel.
Oh no.
A couple things that are happening. I can hear you, but I can't see you, which we've had this problem before with Gardner. So it might actually be that some of the connections in the back are loose. They're not completely, tight.
Yeah.
The other thing is because you keep joining and leaving, that is more of a connection issue than with the hardware
Ah.
versus internet.
Okay.
So I'm actually okay if we don't see each other tonight, although I'll miss your smiling face. But if you can hear me, that's fine.
Yeah, it's good with me.
Okay. So let's continue. And maybe we can just have someone in Gardner check out the system hardware wise. I'll send out an email tomorrow.
Thank you. I appreciate it.
Yep. Okay, so let's do one last one on page 321 in the textbook. We're on genitourinary system. And let's talk about the fibrocystic breast disease. Now, I'm going to probably guarantee that all of you want to start with fibrocystic or even breast, right?
Yep.
No.
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 Disease. Start out with disease, okay? We learned that early on, but we forgot it already, okay? When it's a condition or a disease, we're going to start there first.
Can you tell us the answer to the last one we were doing though?
Oh,
before?
yeah. 00.00.
Okay, good.
Sorry. So disease, what type of disease? It would be breast disease. What type of breast disease? It would be fibrocystic. so fibrocystic breast disease, we started with disease, what type, it was breast, what type of breast disease, fibrocystic. What did you come up with, Lisa?
610.2.
What did you come up with, Emily?
I got 610.3.
What did you come up with, Darla?
610.1.
And
It-
Barbara?
Yeah, I had 610.1.
That's what the 0.3 is, right?
I was still looking. I got lost here somewhere. I went under breast, then it said go to condition, and then
Did you see fibrocystic?
no.
Yes.
Not under breast. Diseases.
Disorders of breast, so disease, breast, fibrocystic. Okay,
I still think it's 610.0.
so Angel, do you have the spiral bound book or the gray one?
The gray one. I'm at the disorder, the breast, 611.9.
Okay,
611.9.
okay, so I'll give you the answer, and then I want you to take and look at your answer and the answer I give you, and tell me why it's wrong. So Angel, what'd you come up with?
611.9.
Okay, the answer is 610.1.
I was off by
61.
Answer,
What was it?
610.1.
0.1. 610.1.
And look at the answer you chose and tell me why they were wrong.
It says disease of the breast.
But yours said unspecified.
Right.
When the exercise
So
clearly
this specifies, is it?
it was fibrocystic. And Lisa, I think you just misread fibrosclerosis with fibrocystic.
Yes, I did.
I was sure I was right too when I read it.
And I will tell you that 99% of the time, that will be why you were wrong.
I have to say it out loud after
Yes.
I read it because
Yes.
that's how I catch myself.
So when you're in the national exam, you're going to have to mouth it and hear it in your head. Okay?
Can you see me or hear me?
I can.
You can see me?
I can.
I can't see you.
I'm right here in full color.
Oh, came back.
Your display must be quieting. All right. Now let's go on to chapter 11 in the textbook. Complications of pregnancy, childbirth. All right, in your guidelines, complications of pregnancy. you'll notice that chapter 11, there is extensive multiple coding with many fifth digit assignments and notes. Your chapter 11 codes actually take precedence over codes from other chapters. You'll see that in chapter 11 is where you will have admission for pregnancy and complication. So if there's an obstetric complication, that would be your first listed diagnosis. Your chapter 11 codes are on the mother's medical record, and they are the 600 series codes. They would not be on the baby's medical record. Your newborn medical codes are 700 series. On the mother's record, you would have the outcome of delivery, which is the V27.0 through V27.9 when there's a delivery. So these are the types of notes, when you find them in your guidelines, you want to be highlighting. So underneath 11E5, outcome of delivery, where it says an outcome of delivery code is V27.
I guess I don't see where you are.
In the ICD-9?
Yep, in the ICD-9 in the guidelines, outcome of delivery, number 5, page 46.
I was still writing down from the other page. Okay.
So some general rules for obstetric cases. Not all of your encounters will be pregnancy related. So let's say a pregnant woman broke her ankle. What would we code first?
Ankle.
A broken ankle.
The fact that she's pregnant is incidental. But we want to make sure that we document it in the chart, in the medical record.
Even though it's probably why she broke her ankle.
Possibly. Remember how I said when you see your guidelines in your textbook, I want you referencing the guidelines in your ICD-9 book. Okay? Because you're going to sit here and you're going to take notes in your textbook, but what good is that going to do you when it comes to the national exam? None. If you're going to make notes, make them in your ICD-9 book. All right, guidelines section 1C11A4, when we talk about the fifth digit.
Will you say that again, please?
That is section 1C11A4. It's the fifth digits.
Okay.
We're talking about the fifth digits.
Page 45.
Thank you.
ICD.
Thank you.
Thank you, thank you.
Okay, you are going to use the fifth digit on all categories except 650 when there's a normal delivery. What would require a fifth digit would be the antepartum, the postpartum, and the delivery. Okay? Your
You said-
categories,
Could you repeat that? I got antepartum, postpartum. What was the other one?
and delivery.
Delivery. Thank you.
When we look at codes 640 through 676.9, they share the 5th digit subclassification. This 5th digit subclassification will denote the current episode of care. 0 being unspecified as to the episode of care or not applicable. 1 being delivered with or without mention of antepartum condition. And all of this is in your ICD-9 book. It's going to be right in the tabular section. 2 being delivered with mention of postpartum complication. 3, antepartum condition or complication. And 4, postpartum condition or complication. Now, selection of the principal diagnosis. If there is no delivery, the principal diagnosis would equal the principal complication. If there is greater than 1 complication, you could use any one of those first.
Would you say that first part again?
Yes. If there's no delivery, the principal diagnosis would equal the principal complication. So if we have something happen that there isn't a delivery of there just isn't a delivery, there's a complication and something happens.
Okay.
So if you have more than 1 complication, you would end up sequencing any one of those first because of the complications.
Can she hear you now?
So you would sequence.
The connection problem.
Uh-oh.
Yeah, they've got to go back and have it.
Yeah, you can begin.
What was your question?
I just saw it in the ICD-9. I was trying to find that sentence that said, where to go?
Yep. Right on page
The
46.
principal complication. There we go.
Routine prenatal visits with no complications, you would have V22.0 for supervision, normal first pregnancy. V22.1, supervision other than normal pregnancy. These would be your primary diagnoses. Page 46 in your guidelines, prenatal outpatient visits for high-risk patients or high-risk pregnancies. You would use V23 category, supervision of a high-risk pregnancy. Move down the guidelines a little bit to the fetal conditions affecting the mother. The fetal conditions affecting the mother, you would use codes from categories 655 and 656. You would assign it only if known or suspected fetal or placental problems are affecting the management of the mother. And that's all right there in your guidelines. These are the things I would highlight or underline. So again, codes from categories 655 and 656. Assign only if known or suspected fetal or placenta problems affecting the management of the mother. Next, it might require additional diagnostic studies observation, special care, or termination of the pregnancy.
Did you want us to highlight that too?
Yes.
Are you on page 47?
46. The bottom.
46. I didn't hear what you guys said there. I keep jumping around.
If it requires additional diagnostic studies, observation, special care, or termination of the pregnancy.
So what that's saying is we would use those codes, 655 and 656, if they were complicated. Okay. And more
Yes.
tests. All right.
Yes.
Thank you.
And just the fact that the condition of the existence of the fetal condition alone does not justify reporting these codes. There's going to be something that is affecting the mother.
Okay.
All right, over to page 47, in utero surgery. Guideline for in utero surgery. When surgery is performed on the fetus, report a code from category 655 identifying the fetal condition. You would not use a code from chapter 15, which are the perinatal codes. These should be used on the mother's record to identify the fetal condition.
How come?
You tell me.
Because it's still affected.
Still affecting the mother. And also, when surgery is performed in utero on the fetus, it's still coded as an obstetric encounter because
In utero. Okay.
utero.
I was forgetting the phrase in utero.
Yes. All right. The next guideline is HIV infection. Let's say the patient is admitted during this period because of an HIV-related illness. If that is the case, the principal diagnosis is going to come from category 647. And then it will be followed by 042. If the patient is admitted with asymptomatic HIV status, we're going to code the 647 category, and then the V08, which is the asymptomatic. Following me so far?
Yep.
And this is all because they're pregnant. That's principle.
Then does it go to another code when the baby's born? If the baby has HIV, is it two separate? Yes. Yeah.
Separate. All right, some of the current conditions that are complicating pregnancy. Next guideline. Assign a code from category 648 for the patient with a current condition that affects the management of the pregnancy, childbirth, or porphyrium. And use an additional secondary code from other chapters to identify any conditions.
Can you give like an example?
Hypertension.
Okay. Thank you.
Welcome. All right. Diabetes mellitus in pregnancy. This can be a significant complicating factor in pregnancy. A diabetic patient or diabetic pregnant patient should be assigned code from the 648 category and then use a secondary code from the category 250 to identify the type of diabetes, because we all know pregnant women can end up with diabetes during pregnancy, and that is called gestational diabetes. Very good.
And it's like fun thing to have.
Yeah, wasn't
Wait,
it
like-
wonderful?
Yeah, no.
Mhm.
Now, if there are long-term current use of insulin, that would be reported using a V code. Where they say long-term current use of insulin, that is a V code. And it would be reported if appropriate. Your gestational diabetes guideline, this will occur in the second and third trimester in women who were not diabetic prior to pregnancy. It can cause complications in the pregnancy similar to those of pre-existing diabetes. It also will put women at a greater risk of developing diabetes after pregnancy. So for gestational diabetes, you would report with category 648. You would not report 648.0 and 648.8 together. And again, if there's long-term current use of insulin, use the V58.67 code. Turn the
What is the difference? Because it's gestational versus if she was, already had diabetes then, right?
Go to your category codes and look them up. Tell me what they are.
Okay. 6488. Okay. Other
So
current
tell me-
conditions. Yeah, I got it.
So can you share out loud?
Yep. The 648 says other current conditions in the mother classified elsewhere but complicating pregnancy, childbirth, or the puerperium. And it needs 5 digits, so. But it does include diabetes.
Okay, but what is the 648.0 versus 648.8?
0.8. Gestational diabetes.
That's why.
Okay.
Good work.
Thank you.
And this is how we learn.
Right.
And this is how we help each other. Normal delivery guideline over on the next page. If there are no complications, principal diagnosis would come from your 650 category. If they do have complications, you would not use category 650. When we have a single live born, we will use V27.0. That's the only outcome for a 650 category code. If your normal delivery is resolved with an antepartum condition, use category 650. Simple and straightforward, okay? Your postpartum and peripartum periods on page 46.
Yep.
Postpartum and peripartum periods. This is after delivery and it continues for 6 weeks. The peripartum period is the last month of pregnancy to 5 months postpartum. Now, there are postpartum complications, and it can occur within the 6-week period. Your complications that occur after the 6-week period may be reported with your Chapter 11 codes if the provider documents that they are pregnancy related. Again, this all comes down to documentation. Complications occurring during the same admission as delivery are reported with 5th digit number 2. And then subsequent admissions and encounters are with 5th digit 4. So if you look at your sub-classifications, it tells you what those are. Under the guideline for care following delivery outside the hospital, if the baby is delivered prior to admission, this would be like in the ambulance or at home or in the emergency department. You would not code the delivery, you would only code the postpartum care. So, care following delivery outside of the hospital, you would only code the postpartum care, not the delivery. And that's right there in your guideline over on page 49. All right, the late effect of complication of pregnancy. The late effect of complication of pregnancy comes under category code 677. Late effect of complication of pregnancy under code 677. This is reported when an initial pregnancy
Sage, lay down.
requires care or treatment. The category can be reported anytime after the initial postpartum period. And like all of your late effects, the code is sequenced following the complicating condition code. Next guideline, abortions.
Before you go into that, sorry, can you give an example of that?
Which one?
The sequencing of the 677 there. After initial postpartum period. So what you're saying is after the 6th week, is that what they're saying?
Yes.
Okay.
Yes.
Okay.
So let's say that, okay, she had an episiotomy,
Okay.
right?
Mm-hmm.
And something happened after the 6 weeks, whether improper scarring or healing or infection. Say it took that long to happen. That would be your late effect. Okay?
Okay.
Abortions. These fall under category codes 634 through 637. It does require 5th digits, 0 being unspecified, 1 incomplete, and 2 complete. The 1 incomplete means POC or product of conception is not expelled, And 2 is complete, where all the product of conception is expelled prior to care. Your 5th digits over on the next page. There are appropriate 5th digits for abortion. You would make sure you use the appropriate ones. Again, unspecified episode, delivered with or without complication, antepartum condition or complication. Make sure you make a note that not all of your 5th digits may be assigned 2 or 4. An abortion with a live-born fetus. This is where an attempted abortion results in a live-born fetus. We would use 644.21, which is an early onset of a delivery. That should be right in your guidelines. You would use a V27 outcome of delivery here. And then also the attempted abortion procedure code. The guideline for retained products of conception following an abortion on page 50 in your guidelines. The subsequent admissions for retained products of conception following a spontaneous or legally induced abortion would be reported from your 634 and 635 categories. 634 is the spontaneous abortion. 635 is a legally induced abortion with a 5th digit of 1 for incomplete. And then the appropriate discharge with diagnosis of complete. Let's look at exercise 12-3 on page 326 in your textbook.
I'm going to do that.
And let's talk about number 4. Number 4 is vaginal delivery of a live-born single infant with 4th-degree perineal laceration, obstetric laceration repaired, include appropriate V code for outcome of delivery. Well, what is the first thing we're going to look at?
The delivery?
Actually, it's the laceration. What is the laceration doing?
It's cutting the child.
Right. It is actually a complication of the delivery. And so we would code that first. So we would start with laceration, type of laceration, the laceration of the perineum. And it's complicating the delivery by what degree? 4th degree.
Wow.
Right. 4.3.
I can't find this one.
What did you come up with, Darla?
I'm still looking. I went back to the guidelines. I'm trying to figure out where to start first.
Laceration.
Oh. Well,
Laceration of the perineum,
okay.
and then complicating delivery, and 4th degree. And just go right in your alphabetic index.
And you got to get a V code, right?
Code is second. That's pretty simple because it's the outcome of delivery. So B27.0.
That's when we go back and look at our guidelines, right? Or how would you go about into the, this is what I just can't remember. To get into the V codes from the first code that I did, how do I find my V code?
Well, do you have your V codes tabbed?
No, that's the only thing I don't have tabbed in this book.
And that's what I would do, is make sure you tab it.
Tab for each number or tab for each?
Tab just for the V code section so you know where it is.
Okay, that's the only part. Is that the same with the E code?
Yep.
Those are the only things that I don't have tabbed in this book. Thank you for that information.
You're welcome. But then also to continue finish the answer for that is you would look under outcome of delivery. Or if it was a vaccination, you would look up vaccination or pre-surgery exam. We know that these are going to be a V code. You still are going to look for them underneath the alphabetic index. They're just a little bit more cumbersome to find. So you have to go back to the section in your V code where, and we'll get into V codes here in the guidelines, and you'll have those marked because it will tell you for V codes, this is what you look under. V codes can be admissions, chemotherapy, vaccination. I forget what else, but there's a section in one of your chapters here. It gives you a whole listing of how to find V code and what heading to look under. I just forget what page it is and what chapter. Okay, on page 253, Lisa, in your textbook,
Yeah.
the bottom of the page, that's what tells you how to look up your V codes. So if you're looking for an admission, that's a V code. You're going to find it under admission. If you're looking for aftercare, it's under aftercare.
Did you say what page did you say?
253 in your
Oh, no
textbook.
wonder. I was looking at 353. I was 253. Right there. I'm just gonna tab that real quick.
Yep. And if you have enough white space in your ICD-9 book, you might want to just make a note that if you have words, these are V codes.
Yeah.
But this is how you're going to look up the V code. By, care of, carrier, checking, contraception, counseling, dialysis. Because we quickly forget that those words direct us to the V code when we're looking them up.
Mm-hmm. Thanks.
Yep. All right,
What'd you say?
yeah, for the code.
The first one I got is the 6643.3.
Need a first digit.
That's where I'm stuck. Okay.
Okay. So what are your
What is the? I lost the page that we were on when I went back in time.
in the textbook? We're on 26.
Thank you.
Okay, so if you look under, this is where you have to look at the main category. So we know that the answer, I'll tell you the answer. The answer is 664.31. And how did we come up with the 1? Well, you have to go at the beginning of your 660 through 669 on page 536 in your ICD-9 book. And if you look at the heading, complications occurring mainly in the course of labor and delivery, you will see right there your fifth digit subclassification items.
I was looking for that list. I didn't go back far enough.
Right.
Okay. Nice. Okay.
So you're going to find it at the beginning of every category section.
Okay, good.
It will not follow every page. So
Right.
you have to know you're going to go back to the top, and that's usually the main category. Okay? So it would be 664.31, and then I gave you the V27.0. All right. The next chapter is diseases of the skin and subcutaneous tissue. And your guidelines is chapter 12, diseases, skin, and subcutaneous tissue. Skin is the epidermis, dermis, subcutaneous tissue, infectious skin and subcutaneous tissue, and scar tissue. Your accessory organs are your sweat glands, your sebaceous glands, the nails, hair and hair follicles, and anything other. You're going to find in Chapter 12 that multiple codes are often necessary.
Can you put me on the right? Oh, never mind, found it.
So let's say cellulitis due to staph. Where are we going to code first?
The staff.
No.
No?
They're doing the opposite. I always know to do.
Oh, do.
Me too.
There's so many exceptions. I'm doing.
Yes. Cellulitis due to. Okay. So cellulitis would be first, 682.9. And then staph, which is 041.1. Now, when you look it up, it might say see also or code organism. Then you would have to code the organism. All right. So page 328 in your textbook, exercise 12-4. Let's look at number 4. The cubitus ulcer of the buttock. Okay, this one gets everyone all the time. What do you think we're going to look up first?
Ulcer.
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 Of ulcer. The cubitus. Cubitus. And where is it?
The bottom.
On the butt. So ulcer, decubitus, buttocks. Look it
Oh,
up.
decubitus.
See, I didn't do the second part of it. This second.
Let's do the first one, then we'll get to the second part.
I'm not sure.
Why write about it?
So, Doreen, this is Barbara.
Yes.
So, I got 70705. So,
Okay.
like, that tells you the whole thing. Like, why is there a second code?
No, it doesn't. Because, does everyone have a code?
Yeah.
Yep, 707.
So 707.05, we found it in the alphabetic index, and we went into our tabular. Now, I have told you that I want you to read the before, the during, and the after. If you look at 707, just 707, the category, it says chronic ulcer of the skin, correct?
Yeah.
Mhm.
Yes.
Then it also says it includes non-infected sinus of skin, non-healing ulcer. It excludes varicose ulcer. So then we go on to 707.0, which is the pressure ulcer, okay? And it tells you it's a bed sore, a decubitus ulcer, a plaster ulcer, and it says use additional code to identify the pressure ulcer stage.
I knew that from work. There we go.
That's why we have two codes here. So you have to be aware and read before, middle, and end. Read your parenthetical notes, your includes, your excludes, the highlighted. This is why we learned all this in the beginning about the C also, the do tos, the whiz, the use additional codes.
But it doesn't have a stage.
How do you know?
Would it be 707.20?
Yes.
Okay.
Yes.
Unspecified. Gotcha.
Yep. So 707.05 because it's of the buttocks. And then we're coding the pressure ulcer stage. So it tells you what codes to already start looking at. So 707.20, pressure ulcer, unspecified stage, healing pressure ulcer not otherwise specified, healing pressure ulcer, unspecified stage. I would read each one just to make sure I'm choosing the correct one. But this is where I said in the beginning, we have to read. We can't just pick the first thing. Okay?
Why couldn't it be 707.25? I noticed there's an alert there because, our description didn't say what stage.
What's unstageable?
Is it because they didn't specifically write stages unable to be clinically determined? Okay.
Yes. All right. We're going to take a quick 5 minutes and come back and move on to chapter 13, okay?
Okay. I need some cocoa.
Cold.
What is the temperature down that way?
Minus whatever. It was like -8.
Wow. Yeah, I had 23 below this morning. Well,
Wow.
late morning. Yep.
Now can you hear me?
I can hear you.
Yep.
Okay, good. How's that?
Good.
All right, do we have everyone back?
I'm here.
Yep.
All right. I think Margaret, you still there?
Yep.
Okay. And Barbara? All right, so I wouldn't lie if I said that I love the musculoskeletal system. Would not be wrong. Only because chiropractic is my specialty. So I love talking about the diseases of the musculoskeletal system. It's also pretty easy to code for. So as I mentioned early on in the class, by the time you're done this class, hopefully, you will have chosen an area that you would like to work in. Most of your specialties should be pretty easy because they only have a certain number of CPT codes that they use, and they have pretty much a wide range of diagnoses to use. So with the diseases of the musculoskeletal system and the connective tissue, you're going to see bone, bursa, cartilage, fascia, ligaments, muscle, synovia, and tendons. Your Chapter 13 sections are broken down by your arthropathies, which is joint disease, and the related disorders. The dorsopathies, which is the curvature of the spine. Rheumatism, which excludes the back. Osteopathies, chondropathies, and acquired musculoskeletal deformities. Newly diagnosed pathological fractures, and extensive notes and fifth digits. So if you go to your tabular, that's how your tabula will be broken up. As I just said earlier, refer to the note at the beginning of the chapter regarding your fifth digit subclassifications. Your details are located there and they are not repeated throughout the categories. And you will find that they are used for the categories 711, 712, 715, 716, 718, 719, and 730. So turn to page 330 in your textbook, and let's look at exercise 12-5. Okay, so this is one of those long ones. We're going to look at number 4. Spontaneous fracture, left humerus, due to metastatic bone cancer, history of cancer of the breast previously excised. Now, they're pretty generous here and they tell you how you're going to code it. They tell you you're going to code first the fracture. What kind of fracture? What kind of fraction?
Left humerus.
Well, that's the location,
Spontaneous.
and spontaneous would be pathological. So start with fraction, and then pathological, and then humerus. And tell me what code you come up with.
I'm not going to look because I did this and I just want to see if I was right the first time.
Fine.
So 733.11.
733.11. Does everyone concur?
No? Did we go to pathological first in our index?
So you go to fraction and pathological.
So 8, 12, 20 isn't right. Okay, so I did do that wrong.
Look at 8, 12, 20 and look at 733.11 and you'll see why you got it that way.
It's about right up for you.
So then the next one would be neoplasm. And it would be neoplasm of what?
Bone.
Of the bone. So you would go to neoplasm of the bone, and it's secondary. Because the fracture happened because of the cancer. Right. Because fracture is the reason for the encounter, we code the fracture first. And then we code the neoplasm of the bone.
No more than that.
I know which specialty I'm not going to go into.
You haven't heard about the heart yet.
Yeah, wait till you get to cardiovascular.
Ooh.
What do you have for secondary code?
Got 198.5.
That's correct, 198.5. And then we have history of code. And it would be history of malignant neoplasm of the breast.
Is it B16.3?
You're off by a little bit.
I hope you're going to walk us through this one.
That's horrible.
Starting history of, the alphabetic index, start with history of.
I was wrong.
Once you find your history of in the alphabetic index, go to malignant neoplasm.
History of. Malignant neoplasm.
Should that be B16.3? That's all I see. History.
And after you find malignant neoplasm, find breast.
Oh, I see what you said. It's in a family history. Yeah, it's just the history of that person.
Yes. History
Am I
of.
right there?
Yes. Everyone find it?
No.
All right, so you're in the gray book.
Mm-hmm.
Let me help. Hold on. On page
I was just there. I'm over in the V section. Let's see. History of. Let me go back there.
on page 1326, second column and midway in the alphabetic index,
Malignant.
malignant neoplasm breast.
B10.3.
Which is the V10.3.
Yep.
Okay.
Then you go into your tabular and confirm it.
Yeah.
You mean in the V codes, right?
Yep.
Okay. V10 point. Why did I get up to V13? V10. Classifiable.
V10. History connection.
I don't know where to find the word. It's not a family.
Did you find it, Lisa, on page 1326?
No, I say it again under the V codes.
Page 1326, second column on the right, about midway, malignant neoplasm of the breast.
Oh, I have that.
Oh, okay.
I'm just trying to figure out because of the V code. I had it wrong because I have it as a family, and
Okay.
it's just an individual, and I can't find just the individual part of it.
Well, V10 right up at the mid, almost near the top, it says personal history.
See, I didn't go back far enough. No, it's not there.
Be on page 761. Yeah.
Personal history. Thank you very much.
Welcome. All right, let's go on to the next section. In your guidelines, you should be on page 52 underneath chapter 14, congenital anomalies. In your textbook, page 330. The congenital anomalies are abnormalities at birth. And you're going to find these under codes 740 through 759. These are the conditions that are originating in the perinatal period. The perinatal period is through the 28th day following birth. Your codes can be used after the 28th day if they're documented that the condition originated during the perinatal period. When we talk about using the codes V30 through V39, V30 through V39, over on page 54 in your guidelines, V30 through V39 are for live-born infants. So V30 is a single live-born, V31 is live-born twins. If they are an inpatient, that is the principal diagnosis. Your V30 is only used once, and it's used at the hospital where the baby was delivered. Use of the category V29. Would assign the code V29 when a healthy newborn or an infant is evaluated or a suspected condition is not found. Do not use V29 when the patient has signs and symptoms of a suspected problem. If they have a suspected problem, you're going to code the signs and symptoms. And your V29 is used secondary to V30. Maternal causes for perinatal morbidity. These are codes from categories 760 through 763. These are assigned only when the maternal condition actually affects the fetus and the newborn. So if the mother has something going on and it's going to affect the fetus, you would use code 760 through 763. So the fact that the mother has a medical condition or experiences a complication does not justify routine reporting of these categories. It must be affecting the fetus. Next in your guidelines, coding additional perinatal diagnoses. You would code newborn conditions that require treatment. further investigation, an additional resource, a prolonged length of stay or LOS, and implications for future care. Also, any insignificant newborn conditions, signs, and symptoms that might resolve with no treatment, and there might not be a code. Even though something is documented, it doesn't mean that there's always a code. If there's insignificant newborn conditions and signs that resolve with no treatment, there wouldn't be a code. It would just be documented.
How would we determine if it's insufficient?
Insignificant by the documentation. This is where you would query the provider if you were not sure about the documentation.
So the clinician would have written that down again?
Yes.
Okay.
Prematurity and fetal growth retardation. You would use codes for newborns from categories 764 and 765. The 764 category is slow fetal growth and fetal malnutrition. Your 765 categories are the disorders relating to short gestation and low birth weight. These are not assigned solely on the birth weight or the gestational age of the newborn. You would use the clinical assessment instead. So this is where the physician's assessment of the maturity of that newborn comes into play. And then you would use additional code for number of weeks of gestation. So 765.0 and 765.1. The next guideline, newborn sepsis. You would code from category 771.81. This should be assigned as a secondary code from category 041 because this identifies the organism. Do not code 038. And do not assign 995.91 for sepsis, assign 771.81. So let's look at exercise 12-6. Page 333. Let's look at number 2. Newborn male delivered in the hospital via vaginal delivery. Undescended left testicle will reevaluate in 6 weeks. What are we going to code first?
Delivery. Descended testicle.
I did the delivery.
The birth. Yeah, the birth.
What's the reason for the encounter?
It was born.
It was the delivery. The fact that the baby was born, that is the reason for the encounter. The undescended testicle we didn't find out until after the baby was born. So it would be the delivery first, the B30, and then code for the undescended testicle.
I gotta get the delivery thing right here. B30.
So the single live born is B3000. There wasn't any complication or cesarean delivery or section. All right, let's look at number 4. A newborn is transferred to a facility because of congenital dislocation of right hip. Code as the facility transferred to. So you're not going to code the transfer. All right. We're going to code what was the reason for the encounter. Right.
The dislocation.
Location.
Dislocation of what?
Hip.
Hip.
What kind of dislocation?
Congenital.
That's how you look it up. So dislocation of the hip, and what kind? Congenital.
I tell you what I got?
No, what'd you get?
I'm going blank. 754.30.
Very good. So the answer for number 4 is 754.30.
Yep.
All right, let's turn to page 56 in the guidelines, page 334 in your textbook. Chapter 10. Symptoms, signs, and ill-defined conditions. Now, it doesn't have a very big spot in your guideline book. It says reserved for future guideline expansion. So all you really need to know here is do not code a sign or symptom if there is a definitive diagnosis made. Only use if there is no specific diagnosis stated. Signs and symptoms are transient or cause is not determined. And the patient fails to return and provisional diagnosis is all that is documented. If there is a more precise diagnosis, that is what you should be using. Now, there are certain symptoms that may represent important problems in the medical care that might exist, and it might be desirable to classify them, but you want to make sure you get a definitive diagnosis. So let's look at page 335, exercise 12.7. An elevated blood pressure reading. All right, what are we going to start with?
Hypertension?
Actually, no. No. Because we don't have a diagnosis. We just know it's elevated.
So blood pressure.
We would start with blood pressure. What kind of blood pressure? High. And this happens to be an incidental reading. It's not like the patient is coming in for a follow-up. This is an incidental reading. So we have no confirmed diagnosis yet of hypertension. So this would be without the diagnosis of hypertension. So we're going to start with blood pressure reading. Happens to be high. It's incidental reading, and it's without diagnosis of hypertension.
How do we know it's an incidental reading?
Elevated blood pressure reading.
But how do we know it's incidental?
Well, why would it be a follow-up, or they just happen to be taking the blood pressure? We don't know what for. I'll give you an example for that. Patient walks in today, and because it's the new year, we're doing the whole vital signs for the new year for electronic health records. So patient walks in and they sit down and we take their blood pressure, and it happens to be 182/95. That would be an incidental blood pressure reading.
But because there's no appointment set up, is that why?
Not necessarily there's no appointment set up, it's just that they're there for a reason other than, let's say, hypertension. So we're doing a workup. Part of that workup on a visit for hypertension would be blood pressure. But if they're just coming in, like today, it was the new year, and we were coming in, they had fallen. The patient had fallen. So we just did a blood pressure reading. That would be considered an incidental blood pressure reading. We have no knowledge of whether or not this patient has hypertension.
Okay, yeah.
So what did you get?
401.
796.2.
6.2. Yeah.
Yeah, I didn't get that.
Blood pressure.
Look under blood.
So high blood pressure. Then look for incidental reading, and then look for without diagnosis of hypertension. And you should have 796.2. Because the 041 would be what? What's 041?
I was in 401.
Okay, what is 401?
401 is hypertensive diseases, essential hypertension. Yeah, hypertension.
But we don't have that diagnosis.
Right. So then why did I go there? Okay. All right. I'm going to do this again.
I don't know, because I gave it to you in the beginning. All right, let's move on to chapter 17, injury and poisoning section. All right, this is where we're going to learn more about fractures, dislocations, sprains, strains, intracranial injury, internal injury, crushing injury, foreign body, burns, late effects, and poisoning. Let's hit upon the burns first. Okay, burns. In your guidelines, burns, let's see. Over on page 57. You always want to sequence the highest degree of the burns. Your burns are actually classified by depth, which is the severity, extent, which is the percent of the body surface, the site, and if necessary, the agent that caused it. The depth of the burn is classified as first degree, second degree, and third degree. The first degree is the erythema. Second is blistering. And the third is the full thickness involvement. All of this classification is based on the extent of the body surface that is involved. If the burn site is not specified, you're going to have to ask for additional data. When you have burns of different degrees, but they're at the same local site, you would report the highest degree only. Your non-healing burns are reported as acute burns. And you would report code 958.3 as an additional code for any infected burn site. Your category 948, you're going to see fourth digits. Your fourth digits are the percentage of the total body surface that is involved. Your fifth digits is the percentage of the body surface involved in third degree burns. And your rules of nines are 5. And we're going to get into all of this in the specific section later on in the book. You should have a diagram in your book talking about the rule of nines. And if you don't have it in this chapter, we will be doing it further on. Let's talk about debridement. Over on page 59, when we talk about debridement of wounds, infection, or burn, your incisional debridement is when there's cutting away, and it's usually performed by a physician. And then you have the non-excisional procedure, where you have shaving or scraping, which might include a water scalpel. This is performed by a physician or a non-physician. Back to page 56 in your guidelines, the injury and poisoning codes, 800 through 999. you will see that there is a separate code for each injury. You would code the most serious injury first. Your superficial injuries are not reported if in the same location as a more serious injury. Remember, when we're coding, we're always coding to the highest degree of specificity. When you have wounds, there might be with or without. You might have without mention of complication, or they may talk about complicated. If it states complicated, there must be documentation showing delayed healing and treatment, or foreign body, primary infection. They might even indicate with tendon involvement. Again, always code the primary injury first. Use additional codes if a nerve or vessel damage. Your primary injury is first, and then your nerve and muscle damage. But if your primary injury happens to be nerve and muscle damage, that would be first. Your acute fracture versus aftercare on page 56. Acute fracture versus aftercare. The active treatment of fractures fall under 800 through 829. Might be done by a physician evaluation, an ER encounter, surgical treatment, or closed treatment. After active treatment is completed, use your aftercare codes. These would be your V codes. Remember, aftercare is in the alphabetic index, and it will bring you to V codes. Multiple fractures. This is the same coding principle as multiple injuries. You would code the multiple fractures by site, and then sequence by the severity. Your codes will describe accidents, injury, and open wounds. If it's not indicated as closed or open, it will be closed. If the same bone is fractured and dislocated, you would code the fracture only, because that's the highest level of injury. All right, over on page 59 in your guidelines. Let's talk about adverse effects, poisoning, and toxic effects. There are some properties of some drugs, medicinal and biological substances, or combinations of these that might cause toxic reactions. These would be classified as adverse effects when the drug is correctly prescribed and administered. You would code the effect first, and then you would use an E-code from the therapeutic column for the drug that's being used.
Say that second part again.
You would code the effect first, and then use the E-code from the therapeutic column for the drug that was used. And it should be right here in your guidelines. poisoning occurs when the drugs and chemicals are not taken as directed. So if it was a wrong dosage that was given in error, when the medication was given to the wrong person, when medication was taken by the wrong person, or medication overdose has occurred. Medications that are taken in combination with alcohol and recreational drugs. This would be a poisoning. Over-the-counter taken in combination with prescription drugs without prior approval. This would be a poisoning. On page 60 in your guidelines, sequencing of the poisoning. The poisoning code from the table of drugs and chemicals comes first.
What page are you on?
I'm on page 60 in the guidelines.
Okay.
Under the toxic effects? No, sequencing of poisoning, right?
Poisoning.
Okay. Thanks.
You're welcome. So poisoning, use the poisoning code from the table of drugs and chemicals first. Then use the manifestation of the poisoning second. And then your corresponding E code from the table of drugs and chemicals last. If the intent is unknown or questionable, report the intent as undetermined. Your E-codes simply provide supplemental information. They should not be used as first listed diagnoses. They identify the cause of an injury or poisoning, the intent, and the place it occurred. So again, your E-codes are never first listed diagnoses. You have an E-code index, and you can use the E-codes with any code in volume 1. For an initial encounter, you can use an E-code. For a subsequent encounter, you can use late effect E-codes. So what is intent? Under intent, we might have unknown, unspecified, or questionable.
I guess I just lost you.
It's not in the guidelines.
Okay.
So if we have intent that is unknown, we're going to code it as undetermined. If we have intent that is unspecified, we're going to code it as undetermined. If we have intent as questionable, we will code it as undetermined. And that would be on page... Sorry?
Can you say the last thing you said, please?
Unknown, unspecified, and questionable will all be coded as undetermined.
Okay.
And if you look on page 343 in your textbook, it will be there. if you look at your table of drugs and chemicals, just look at the example on page 345 in your textbook, please. You'll see that your table of drugs and chemicals is an alphabetic listing of the codes. Do not code directly from this table. You would look at this table and then go into your tabular to confirm the codes. When you have two or more substances that are involved, each code might have a combination code, or if you have two or more substances, each code might be under a combination code. So two substances might have one code, might have one combination code. So you're going to have to be careful of that. You want to code the substance more closely that is related to a principal diagnosis, and then include one code from each category, such as cause, intent, or place, when we talk about two or more substances being involved. All right, undetermined cause. Undetermined cause, turn to page 82 in your guidelines, top of the page, undetermined cause. If the intent is known and the cause is unknown, use E928.9, unspecified accident. If there's suicide and self-inflicted injury by unspecified means, use 958.9. And if we have assault by unspecified means, use E968.9. Late effects of the external cause guidelines. These should be used with a late effect of previous injury and poisoning. They should not be used with related current injury code. How's everyone's head right now?
Scrambled.
Good. All right, we have about 25 minutes left. What I'd like to do is run through the answers quickly on the chapter review and practical in the workbook. And then hopefully we'll have time to answer a few questions. If I need to do some one-on-one, email me, I'll be happy to do that. Let me get through the answers first, and then we'll answer specific questions. Before that happens, let's go over homework so that if we get cut off, you know what homework will be. Homework for next week is chapter 13 and 14. Read the chapters, do the in-chapter exercises, end of chapter review and practical, and workbook even numbers. 13 and 14. You should be doing chapter 12, evolve exam. And bring your CPT books next week.
I thought we had to do 13. I already did the whole thing.
Oh, good for you.
Just I'm one step ahead.
Great. All right, let's do chapter 12 review, page 356 in your textbook. All right. Number 1 and 2 are false. Three is true. 4 is false. 5 is true. 6 is false. 7 and 8 are true. 9 is false. 10 is true. All right, number 11. Nephrogenic diabetes insipidus. What are we going to start with?
Diabetes.
Diabetes. 588.1. Number 12. Ovarian cyst. What are we starting with?
Cyst.
620.2. 13. 654.13. Now, again, I'm going to remind you, do not erase. If you got them wrong, just write the correct answer off to the side. Put a line through it. And the reason is because I want you to go back, look at the wrong one, look at the right one, and try to figure out why did you get it wrong. And then if you can't figure it out, email me. 14, 674.14.
What? Could you repeat that one?
674.14.
That was all.
I couldn't get that one.
You want to start with dehiscence,
Okay.
not cesarean. Start with dehiscence. 15, V30.01, and then 764.98. Number 16, 565.1. Number 17, 569.85. You're going to start with the angiodysplasia. Number 18, 592.0. Start with the stone. Number 19, 681.11. You're going to look up parenchyma. Start with parenchyma. Number 20, 685.0. You should have looked at cyst, pilonidal, and then with abscess. 21, 71596. 22, 722.83. 23, 746.4. 24, 747.0. 25, 785.1. 26, 783.0. Lack of is where we would start. Lack of. 27, 916.5. We start with injury. Believe it or not, it's an injury.
I couldn't figure that one out.
Everyone gets that. Everyone gets stuff. Actually, on the next two, 916.5 is the first code, and then E906.4 for bite of a non-venomous insect. And I have to tell you, for the whole time that I have been teaching, probably one person has only gotten it right. So don't worry about it. 28, 692.71, because the sunburn is unspecified. And then there's actually an E code for sunburn, E926.2, because it's poisoning. 29, 708.0. And then the E code is E930.0. Now, let's talk about 30. Okay, 30 gets everyone as well. Chest pain due to cocaine. Now, it gives you 4 spaces. Okay? Chest pain due to cocaine. What is the reason for the encounter? Chest pain.
Chest pain.
What's the chest pain from?
Poisoning.
Poisoning of
No.
Cocaine.
cocaine. So we look up the poisoning first. All right, and that would be 970.81. So then what did the poisoning of the cocaine do? It caused the chest pain. And it's actually unspecified chest pain. So the next code would be 786.50. Now, I don't know how often cocaine for the first time would cause chest pain. I don't have those statistics. In this scenario, they're talking about the fact that it was an abuse of cocaine. Okay? So it's unspecified use. They're considering it abuse of cocaine. So 305.60. And then the actual poisoning E code would be E980.4.
What was it?
Sorry, E980.4. So I'll read the 4 codes again. 970.81 for the cocaine poisoning. 786.50 for the chest pain unspecified. 305.60 for the abuse of the cocaine unspecified use. And then E980.4 for the poisoning of the cocaine undetermined. If you didn't get that, please do not beat yourself up over it. Okay? Honestly, this gets everyone every time. You would have to be a pretty seasoned coder or have had some experience with abuse and poisonings and that type of stuff. Okay? 31, 560.9. Because why? There's an obstruction. 32. Let's talk about 32. Mrs. Smith is at 32 weeks gestation and is admitted with severe bleeding with abdominal cramping. An emergency ultrasound is done and fetal monitors are applied. She is diagnosed with total placenta previa with indications of fetal distress. An emergency C-section is done with delivery of a viable male infant. Well, what does she present with? Bleeding, right? Okay.
Abdominal cramping.
She actually was diagnosed with placenta previa. When we have a diagnosis, that gets moved to the forefront. That becomes primary. So pregnancy is complicated by the placenta previa. You would start with code 641.11. Then we need to indicate the distress, because the fetal distress is affecting the mother, is affecting the management of the pregnancy. So we then have 656.81. Then we have a pregnancy complicated by the early onset of delivery code, 644.21. And then we have the outcome of the delivery, single live born, V27.0. Does everyone see those?
Yes.
All right, 33. 789.00 for the abdominal pain unspecified. 780.60 for the fever. 788.1 for the dysuria. The urosepsis is not coded because it was ruled out. Remember, you do not code rule out.
Wow.
Number 34, chest pain, 786.50. Then we have epigastric pain, 789.06. You would not code the myocardial infarction because that was being ruled out. Number 35, the first code is for the non-union fracture, 733.82. The second code is for the anemia, 285.1. The third code is for the late effect of the fracture of the lower extremity, 905.4. And then the last code is the late effect of the motor vehicle accident. You would have an E code, E929.0. Any questions on any of those? I'm going to do just the even numbers for the workbook. And if you have any that are nagging you after class, send me an email and we'll try to go about it in email. Now, Number 2, in the workbook, Chapter 12, 528.2. Number 4, 552.3. Number 6, 571.6. Number 8, 016.00 and 590.81. Number 10, 648.13 and 244.9. Number 12, 682.7, 682.6, and 041.10. 14, 707.03, 707.20. 16, 705.83, 18, 721.0, 20, 727.1, 30.01, 749.20. 24, 789.1, 26, 791.0, 28, 783.5, 30, 810.00, E887, 32, 913.0, 34, 850.9, 36, 924.01, 38, 832.02, 40, 578.9, 789.00, 965.61, and E935.6.
Could you name off the last one, the E one?
E935.6. 42 should be admission for dialysis and acute renal failure with V56.0 and 584.9. 44, I'll go ahead and stop here, and we will finish this come next class because I don't have time to finish the rest in 3 minutes. I will go over some reports with you. If you attempt the reports for 13 and 14 and you can't get them, don't do them. We'll do them in class. Tonight was not usual. We usually have time to spare and go over reports. So I will be quicker going through the chapter work next week and spend more time on reports. So again, if you don't get reports completed for next week, don't worry about it. We'll do some in class. Any questions?
No.
When it comes to the reports, if it's an operative report, look at the post-op diagnosis. That's what you're going to start with. It won't be in procedures yet. And if you look at a report and you say, what in the heck is this? Just don't do it. Okay? All right. Have a great week, everyone.
You too.
Thank you.